Hi, I'm Dr.Nithin Reddy, consultant physician and diabetologist at Renova Hospitals, Kompally. So another important thing to note down during the summer is uncontrolled sugars. So because it's a season for some seasonal fruits. You have like mangoes. So we see a lot of people coming with high sugars, and also it's a season for especially some patients with Muslims. They do fasting, so they are not able to take insulin at the proper time or any medications during the proper time. So we see a lot of patients with uncontrolled sugars during these next 1 or 2 months. So I would say make sure you avoid excessive seasonal fruits. So you can have mangoes once in a while. So make sure if you are having a mango, I would say have a little bit, maybe a 50 grams of mango, and make sure you don't have daily. So mix it with other fruits, and whenever you're having a mango, don't have another fruit. So just one fruit per day, and limit it to at least 50 grams, not more than that. And make sure you take your medications regularly. Make sure you get hydrated. Because if you don't get hydrated, there are high chances that there are other complications of diabetes which are very common. So make sure you avoid these kind of fruits and sweet sugars. And also there are high chances that people don't do regular physical activity because of the high temperatures. So at least give some time in the early mornings or in the evenings. Make sure you do at least 30 to 45 minutes of physical activity per day. And don't skip your medications. Make sure you visit your physician. If it's not possible to visit him, at least don't skip the medications or don't stop any medications until you visit your physician. And regarding the fasting, there are a lot of Muslim patients during the Ramzan. So we are seeing they come that I'm fasting, so should I continue taking insulin? So I would say it depends on how much are their sugar levels, glycemic index and all. So patient who is on high dose of insulin, I would definitely recommend him to avoid fasting, because fasting is not really recommended for uncontrolled diabetic patients. So patients who are on mild OHAs, so we can modify a little bit of dosage depending on their high food intake usually they have in the early mornings and again in the nights. So we avoid the tablets in the afternoons or in the mornings. So we will put them on a higher dose in the night. So that's how we fix them before they are in this season. But whoever is on high dose of insulin, so I would definitely recommend them to avoid going to fasting, because things get very very difficult to control after fasting for so many days. Because whenever you do fasting, you try to eat a lot and in one meal, so that can cause high sugars, and it will be very difficult to control it after so many days of fasting. So in case you are on high dose of insulin, so I would definitely recommend to avoid going to fasting. And if you are on moderate or mild dose of diabetic medications, make sure you visit a physician before you're going into fasting, and make sure you have correct dose of diabetes, and make sure you try to limit your sugars, try to have more proteins and limit your sugars, have healthy carbs and little bit of fruits. So make sure you follow this strict diet so that you can prevent any complications of diabetes. You have a lot of complications of diabetes like diabetic nephropathy, retinopathy, like eye related issues. You will have heart related strokes, brain strokes, nerve related issues. So there are a lot of complications of diabetes. So in case your sugars are controlled, there are high chances that these complications are less likely. So make sure you visit your physician and make sure your sugars are under control, and keep yourself hydrated. Thank you.